From WRAL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Thursday, May 14th, 2020. I'm Cliff Baumgartner. Here's the latest from WRAL.com. Today, the State Department of Public Safety announced they have a plan to test thousands of workers at North Carolina prisons for coronavirus. The virus has infected nearly 650 inmates in 11 prisons statewide. At least 5 deaths from the virus have been reported at the time of recording, but DPS doesn't publish statistics on how many prison staffers are infected. The agency tested every inmate at Noose Correctional Institution in Goldsboro after an outbreak there found hundreds were infected, and most didn't show symptoms of COVID-19, the illness associated with the virus. DPS offered virus tests to any staffer at Noose Correctional who wanted one, but there was no mass testing effort there or with staff at any other North Carolina prison. Originally, State Treasurer Dale Falwell lined up 20,000 tests for prison workers and said the state health plan, which he oversees, would pick up the cost. But DPS balked at the plan, citing concerns over the safety and privacy of employees lined up in parking lots to get tested. Details of DPS's new testing plan were not immediately available. Today, Governor Roy Cooper and Dr. Mandy Cohen, Secretary of the State Department of Health and Human Services, said key pandemic indicators officials are tracking have remained fairly stable in the first week of Stage 1 of the state's reopening plan. North Carolina has again added 1,000 new coronavirus cases in less than 2 days, moving up to more than 16,600 as of today. Statewide, 637 people have died from the virus, with a Wake County resident among the latest deaths as of the time of recording. Yet the 7-day rolling average for new infections remains fairly flat, at an average of 444 new cases per day. Also, the percentage of people testing positive for the virus remains low, at 7.5%. While more work remains to be done, officials are looking ahead to future stages of the reopening. For one example, neighborhood swimming pools could likely open under the second part of the state's 3-phase plan. Phase 2 could come as soon as May 22nd if positive trends continue. Cohen said state health officials would provide guidance on how pools can operate safely and limit the spread of coronavirus. As the state tries to expand coronavirus testing to aid in the reopening, the DHHS website has added a daily list of free testing sites across North Carolina. The CARES Act for coronavirus relief provided $175 billion to healthcare facilities and doctors who lost business in order to prepare for a possible hospital surge. Newly released data from the Centers for Disease Control breaks down those individual payments and shows the North Carolina providers received a total of $757 million from the main pot of money. The disbursements range from tens of millions of dollars all the way down to a few bucks. The top 5 recipients in North Carolina are Duke University Health System, Carolinas Medical Center, UNC Hospitals at Chapel Hill, the Charlotte-Mecklenburg Hospital Authority, and finally Forsyth Memorial Hospital. WakeMed and Rex Hospital each received over $22 million. The Atrium Health System also received a total of $70 million for its 4 medical centers from another relief fund. Rural hospitals in our area also received much-needed cash infusions after they had to cancel elective surgeries, which are the lifeblood of their business. And finally, from WRAL TechWire, Burlington-based life sciences company LabCorp is rolling out a suite of services to help companies bring employees back to work as the COVID-19 pandemic drags on. The return-to-work service includes employee check-in health questionnaires, temperature screens, virus test collection either at the job site or off-site, and employee access to LabCorp's testing, including an at-home test kit and a new fingerstick antibody blood test. Later this fall, flu vaccination services will also be available. Adam Schechter, the chief executive officer at LabCorp, tipped on today's new program yesterday in an interview with CNBC. Schechter also said the current capacity for COVID-19 testing is sufficient to support a reopening of the U.S. economy. In a statement made today, Dr. Brian Cavaney, chief medical officer and president of LabCorp Diagnostics, said, quote, "We have been helping keep people safe and healthy for 50 years and are uniquely positioned to assist employers in their return-to-work strategies," end quote. This has been your Coronavirus North Carolina News Brief for Thursday, May 14th, 2020. As always, if you like the information and resources you get from this show, let us know. Leave a rating and review wherever it is you listen. And while you're there, be sure to subscribe so you don't miss our new episodes. Thanks for listening.